Mentri rangbah jong jela Meghalaya Conrad kongkal sangma hakasing baar jong tayo ula Plie ki arpautli ki Health and Wellness Center lyngba ka National AYUSH Mission ha ka jingalang kebelalong ha yojana bhavan ha kenong ba shilong ha kini ke jing Plie laidon rengkat Mentri ketenat kakoi kakya James PK sangma Chief Secretary ke jela ba DP walang ki doktor ki bedang shulet trei kakam bat ki wede ki he officer sarkar Habakirana ke jingilang Conrad kongkal sangma uloong bak sarkar jela ke buah khmat ya ke syongsuk syongsan kakot kakya bat ke Puli Putih. Bat ke sarkar ke lasyam mikilat ban penbiang ya ke jaka ajing sumar ke badan hakal leng ke jela. Mentri rangbah ula kentui ki doktor ki badang shulet chimti ya kakam bagi mendai ban sngau bagi syale ben hak sarkar baka pha eki sya ke jaka ajing sumar ke badan hakithan nong kendong. Bat uloong balada ki doktor ki kwa banit trei tang hakanong ba shlong bat hatura. Manopat banai ajing sumar ki patba hakit hanong kendong. Hadin kania Conrad kongkal sangma ule keren ru bat kini ki doktor ban sengap ke jing ke bagi kendo hak ban ajing sumar ki patba ak jaka ki badan hakaleng ki banta jong ke jela. Kenang ba ke sarkar kan yok ban chim kya ye gini ki jing ban la ban ajing syakri ka ba khambha ya ki patba.
Is that we've seen that doctors end up spending a lot of time reporting. And you have to write the records of the patients, you have to make the report, put down paper, document it, write it, type it, whatever. And what happens is that you end up spending more time doing that than actually attending to patients. So the official work, because of the system that is present right now, overtakes the actual health part. And hence we need to kind of reform the overall administrative working of the health department to be able to allow doctors to do their primary job, which is to actually take care of the patients. So these kind of reforms are also required in the system, which I'm happy to share with you that with the use of technology, the Reboy district, which is the aspirational district, is being taken up first. An entire record of the patients is being computerized. And this will be put in a centralized server, which means once the patient, and obviously only people who have access to this through password and username will be able to access it. So entire record of this patient is kept. So this will be a system which will be, I feel, very important because you will be, we'll figure out a system there where the entry of all the records of the patients, the reports that are there, does not fall on the doctors. And from a larger scale for the state, we will see that there will be a complete data analytics going on, which will then allow us to predict in the future that what and when which kind of diseases are coming in and which areas are facing what kind of diseases, and obviously that helps us to ensure that the machines are there, it helps us to ensure that the medicines are there, it helps us to ensure that we are ready before time. And a simple example of that is diarrhea, for example, for children. So we may be able to see that there's a trend in this entire data analytics after we have these patient record systems, where we'll be able to see that in the month of June, July, when the monsoons start, we suddenly see the diarrhea cases in children go up. So I'm sure that that's also the trend, but the data out there will then allow us to predict that. So which means that the department will be ready in the month of March, saying that we'll make sure you get all the medicines ready for it, the doctors should be ready for it. So this kind of administrative reforms and system reforms, use of technology, being able to predict what's happening in the health sector, these help us plan things in a much better manner. I mean, I hope that you all will, I'm sure you have it, but you have to keep reminding yourself about it. That yes, you have a duty to do, yes, it may end at 5 o'clock in the evening, but if you being able to do just that little bit more to save another life, because really you can, you know it, and then be able to do it, I think that sense of purpose, as was mentioned by Mr. James, I think really is very crucial, more so in your sector than in other sectors, because you can really actually, as I said, you can save lives, and that's really what matters a lot.